My name is Debbie Goliley. It's nice to meet you. Glad y'all are here. Um, I'm still not great at doing web videos, so bear with me. I'm trying to learn and trying to get more comfortable in front of the camera. For me, this is really a big thing, but I'm glad you're here. You can visit my website, www.survivingheartsurgery.com, or find me on Facebook, Surviving Heart Surgery, as my Facebook page. The one thing I want to talk about today is coronary artery disease and depression, open heart surgery and depression. That seems to be a huge thing that everyone has questions about or has issues about. And I want you to know that you're not alone. I remember after surgery, I had my open heart surgery February 26, 2010. It was the most challenging thing I think anyone can go through. I know everyone has different issues afterwards. One of the statistics that I ran across today as I was kind of looking at depression and open heart surgery or heart attack, coronary artery disease, said that among patients with coronary artery disease, depression occurs in 18 to 20% of those who have not had a heart attack. It goes up drastically for those that have had a heart attack or a history of heart attacks. Depression in those goes up to 40 to 65%, which is huge. That's a large amount. People that have had CABG surgery, 50% of those experience symptoms of depression. Another thing that really struck me is they said 796 of cardiovascular physicians were surveyed. 71.2 responded. Fewer than half of them asked their patients about depression. So what does that say? I think that says a lot about why so many people comment or email me about the way that they're feeling about the depression or feeling overwhelmed. I think that's normal. I think the statistics show that that's normal. So I don't want you to feel alone. I know I felt really overwhelmed my first year after surgery. That was the hardest for me. It sounds like that's the hardest time for a lot of people. The first few months you're doing good, just making it through your recovery. Every day can feel very much like a huge struggle. I remember, I think the best advice that my surgeon actually gave me was that for every good day, you'll have 3 bad days after that. And for me, that was really true at first. So remember that and be patient with yourself. Give yourself time to heal. Allow yourself that space to heal. The other thing is that it does get better. My second year, I was feeling better. I was still depressed, although I had gone to the doctor, and I would advise anybody, if you're feeling depressed, talk to your doctor, whether it's your cardiologist or your primary care physician. There is medicine that can help. I know a lot of people were against taking another medicine. Probably all are on tons of medicine. Yes, it is just one more pill. But if it can help you feel better, then try it. I know it helps me. It helps me a lot. I still had bad days. It's not a miracle cure. I wish there was a miracle drug that would just make everyone feel better after surgery, but there's not. But by my second year, I wasn't feeling as depressed. What I was doing my second year was really reevaluating my life, what I wanted, what was important, how I wanted to live the rest of my life. I guess for any of us who've gone through open heart surgery or heart attacks, you're really forced to face your mortality. We're not going to be here forever, but it really does make you stop and look at your life and reevaluate, which is what I did. I can't say that I made a lot of right choices in my reevaluating and probably could have handled things differently, but we're all doing the best we can do. What I can say is that now, 3 years out from surgery, I'm not feeling depressed anymore. I'm happier than I was before surgery. I am more confident. I think I'm more at peace with who I am and where I am. Do I still get scared sometimes? Yeah. I think we all every now and then have strange sensations or feelings in our chest, and that's always going to be a little bit of a concern. So I want to give everyone hope. I want to give you hope that it does get better. The best advice I think I can give you is to be patient with yourself. Love yourself. Don't be critical. The way life was before has changed. It just has. I know I always said that I wanted the old me back. Well, let's face it. Life has changed. Every day has changed. We're never going to be the same as we were the day before. We're always learning. We're always growing. We're always evolving, which isn't a bad thing. I think we might have been thrown into a whirlwind of change very quickly, but we would have changed anyway. So, me saying that I want to be the old me really wouldn't be true because I'm never going to be the same person I was yesterday. I'm always learning, I'm always growing, and so are you. So, what I can say is take time for yourself, let others help you. You don't have to be Superwoman or Superman. You don't have to be the world's super mom or super dad. Just let others help. Sit back and relax some. Take a breather. Whether you've had a heart attack or open heart surgery, let your body heal. Give yourself a chance to relax. Enjoy life. Just be patient and not overly critical. Sometimes I think we're our own worst critics. I know I was. I remember thinking, why can't I get over this? Why is this bothering me? Even anxiety. I remember thinking, why can I not be like everyone else? Why can I not walk in a break room when there's 15 people in there and not feel anxious? But it was what it was. So I learned to just relax. I would have someone else go in the break room with me. I would bring some of my own snacks, so I wasn't going in the break room. Just find simple ways to deal with things and just take it slow. But most of all, be patient with yourself. Reach out for help. Um, Allow others to be there for you. Don't always feel like you have to be the strong one. And find groups. A lot of the hospitals have support groups. Find those. Reach out to other people. If you're not comfortable going to those, look online. Find some support groups online. Inspire.com has a wonderful open heart, what it's called, open heart bypass group. They also have a women's heart group. Those were tremendously valuable to me. The people there, they're open, they're honest, they're real. They reach out, they help. If you have any questions, I guarantee you someone's been feeling the same thing or has the same questions you do. So reach out to people. Most importantly, don't feel alone. Don't feel like you're all by yourself in this because you're not. There's a huge group of people that want to help you. That's one thing I've learned is anyone who's gone through open heart surgery or heart attacks, that gives you a sense of connection. Because unless someone else has gone through it, they want to understand, they want to feel what you're feeling, but they can't unless you've been the one that's there, not knowing if you're going to live or not. Um, you're the one that went through that day or two after surgery in the ICU when it was hard to even take a breath. And I know for me, I remember thinking, please don't let me have to go back through that again because I don't know if I'll make it. And If you read my story, I may not have made it, but if I had to do it again. But either way, I'm here, and there's plenty of people on my Facebook page who reach out and comment and help. Inspire.com has a wealth of information and people that are there for you. Check your hospitals. They have a lot of local groups that you can go to. Just don't feel alone. Be gentle with yourself. Take time. Remember to just sit there and relax. There's usually not anything that can't wait and be done later. So be patient with yourself, and most of all, love yourself, because you're important. And if you're feeling depressed, talk to someone. Talk to your doctor. Um, just get some help. I don't want you to feel alone. I felt alone and really didn't know where to turn. So that's what I want to do, is help others. So again, if you haven't visited my website, www.survivingheartsurgery.com. You can also find me on Facebook. My Facebook page is Surviving Heart Surgery. And reach out to others. There's plenty of people here for you. Okay, well, don't want to run out of things to say, so for now that's it, and I'll try to think of some more things for another one, and maybe connect with some of you. And I'm still looking at trying to find a place to have an online video support group for anyone who wants to join. So if anybody knows how to do that, or wants to help assist on that, I would appreciate it. Thank goodness I have kids, but they're not in my house now, so I have to call them and ask them and get help. So, but thank goodness I have them. I don't know how I would do all this technology stuff without them. So anyway, love and light to all of you. And thank you for stopping by and visiting. And I look forward to getting to know everyone better. All right. Thank you. Have a good day.